I've been working for many years in looking at how do we keep birth normal.
Yeah.
Just intuitively thinking it's bizarre that women are having to be subjected to all sorts of drugs and interventions in childbirth. And so initially we started working on models of care, and what we found was if you have continuity of care from a known care provider, you're much less likely to have intervention in childbirth. But when we looked even more closely at that model of care, we found that when these midwives worked in different kinds of environments, they behave differently and they do more things to the women because the midwives feel under surveillance as well. At home, you would do less than you would do in a tertiary hospital, and a birth centre is halfway between. And there are now been a couple of studies that have looked at that on a national basis. In the UK in particular, the Birthplace UK study that was published late last year also demonstrated that if you give birth at home compared to in a tertiary hospital, obviously you're much less likely to have intervention. And these are for women of the same risk. So it isn't anything to do with anything inherently in the woman, it's something to do with what's going on in the interaction between the different kinds of spaces they're in and the model of care. So basically my interest is just to see how can we increase the possibility for women to give birth normally, because it's important. Well, currently for most birth units, the bed is centre stage. And if you understand the idea that for the woman, being on a bed centre stage means she's open and exposed to everybody and under constant surveillance, then you simply have to keep thinking of ways to reduce the level of surveillance and increase the level of privacy and intimacy for the woman in whatever you design. So there are simple things like no door should actually ever open onto the bed. No door from the corridor opening onto the bed. You need to have some kind of an entranceway and a passageway and then turn a corner to get to where the woman is. That increases her sense of security, that people can't come in uninvited. So neurophysiologically, things are less likely to go wrong. I guess increasing intimacy and privacy and decreasing surveillance would be the principle to bear in mind. Certainly the hospital, new maternity hospital that's being designed at Royal North Shore has incorporated many of the design principles that we've derived from literature reviews and interviewing women and the small amounts of research that are being done in the area. So hopefully that's going to be a very radical new example of what a birth unit could look like. There are certainly some examples in the UK of freestanding birth centres that have been recently built and opened, which have incorporated many of these principles too. I can't think of particular cities, but I visited several of them. There are lots of challenges, of course. Obviously what happens is when you get a brilliant design, then it has to be filtered through occupational health and safety, infection control, and finally the budget, which often strips away many of the kind of important design features because people regard them as non-essential. And I think people have to start sticking to the evidence around what is it that we actually need in this space that works for the woman, rather than saying, oh, well, that's dispensable with. We can do away with the nice wooden features. They're actually a critical part of how the woman's able to respond in terms of her neurophysiology in different kinds of spaces. So they're not things you can dispense with. Newly graduated midwives that have come out in probably the last 5 to 10 years actually have a very different orientation towards the culture of birth. They get frustrated because they have been taught to see birth as a very normal process. They should unfold in a very straightforward way unless there's something seriously wrong. They get quite frustrated in the current system when they see procedures being performed on women potentially unnecessarily. And so the new group of midwives are not yet senior enough to be able to have any power within the system in order to change it. So basically what we have to do is start presenting this material to more and more audiences of midwives. But we also have to be able to provide them with very good examples of beautiful spaces that are actually optimal for childbirth, and show them the evidence of what the difference is if a woman is enabled to labour and give birth in there. they are usually convinced by the evidence to be able to let go of some of their strongly held practices. I seriously present the ideas around epigenetics. If women continue to be exposed to all sorts of drugs in particular and other sorts of interventions during childbirth, it looks like it's doing something to the human epigenome, and we need to say stop it now. So we need to do something radical, and it's not only changing models of care so that women have continuity of care from a known care provider throughout the experience, but it's also doing something radical about the environment and changing it from what it is. It's going to take a huge shift. But architects, I think, and interior designers and health facility planners can be the leaders in that process, because they have the most ability to persuade the practitioners and the clinicians that there is evidence that this is different, that it changes the outcomes for them. If we don't change the processes, the outcomes will continue to be what they currently are, and I'm not sure that that's a good thing for humanity. I mean, I think that's where our bud set tool is useful for existing units, to take it around, to say, okay, so noise is an issue here, so what can we do to retrofit this place to decrease the noise level? And that's quite major, because you can't kind of rip out the walls and put in insulating materials, but you can look at what kind of floor surfaces do we have here. We could change the floor surfaces, for instance. We could put acoustic tiles on the ceiling to be more sound absorbing. So they're things you can add afterwards that actually might lower the noise level and decrease the level of stress. So those are simple things.